welcome to another episode of Headline Canada. Today, our special guest is the Health Minister of Canada, Honorable Ginette Petitpas. Hello, Minister. It's a pleasure to have you on our show.
Well, thank you so much for having me. It's wonderful to be in Brampton.
Minister Taylor, recently Health Canada has released a new food guide almost after 12 years, and now you have announced that the food guide is available in 28 different languages.
Correct. So we launched the food guide back in January of this year, and the reception from Canadians from coast to coast to coast was very, very positive. So today I was pleased to be in Brampton to announce that the food guide will now be available in 26 different languages. It's really exciting. We recognize the food guide is a very valuable tool for all Canadians, and we want people to be able to use this tool, but we also want to make sure that they can read the food guide. So that's why that we've made the investments to ensure that 26 languages that the food guide will be translated into.
Health Canada is encouraging Canadians to mainly focus on, consuming plant-based protein rather than processed food. But do you think that there is a need to dairy food products now?
Well, I think we have to take a few steps back. If we look at the last food guide, the way that it was made, it really wasn't focusing necessarily on our new plate as it is now. For the food guide that we launched this year, we certainly wanted to make sure that it was easy and simple for Canadians to understand. And if you look at our plate, it is quite simple. We encourage Canadians to eat half of their plate full of veggies and fruits, and the other quarter of the plate would be protein. So that could be plant-based protein, or it can be meat as well, but the other quarter as well is grains. So we certainly just want to make sure that this tool is very easy and practical for Canadians to understand. If we look at the old food guide, we talked a lot about portions and sizes. Let's be frank, most Canadians don't walk around with a spoon in their purse to measure their food. But this food guide, the new tool that we've brought forward, is simple to understand, and really the feedback has been tremendous from all Canadians.
As per you, what is a mindful eating?
Well, with respect to me, I think that with respect to eating, it's more than the food that we put in our bodies. It's all about the eating experience. I know when I think about eating, I think about spending time with my family when I was growing up. So we really want to encourage Canadians not only to eat well, but also to enjoy the foods that they're eating, and also to remember that cooking can be a very, very good choice, because we certainly know when we cook, we know what we're eating and what we're preparing. And also we want to encourage families to cook with their children as well. I know growing up for myself that I cooked a lot with my mom and dad. My dad was the gardener and my mom was the one in the kitchen. And I got my good healthy eating habits from my parents. So we certainly want to encourage more Canadians to really savor that food experience and to share it with their families and friends.
You said that you have received a positive feedback from Canadians. You want to share what kind of feedback people were sharing?
I have to say that when we launched the food guide back in January, it has been overwhelming. When we see the amounts of people that have downloaded our food guide, it has really been tremendous. And people are telling us, many Canadians are telling us this was the way that they were eating, but now it just validates it and it just makes it a whole lot easier. And we've certainly heard from many schools and different dietitians and different healthcare groups that they really support the move that our government has made in making sure that the food guide was evidence-based and was not influenced by industry.
Is the new food guide application viable for poor and marginalized?
Absolutely. In actual fact, if you look at the food guide that we've created, we've really taken all of those factors into consideration. And actually, the University of Guelph did a study. I believe it was the University of Guelph, but there was a university that did a study on the actual cost of the food guide. If we compared the old food guide that we had to the new food guide today, that an actual family of 4 would save more than $2 per day following the new food guide. So if you look at the snapshot or the chart of the food guide, if you look at the plate of food that is there, it's not all fresh fruits and vegetables, to give you an example. So there's some tomatoes on the food guide. Well, those tomatoes actually are canned tomatoes. And there's some fruits and vegetables that are frozen fruits and vegetables. So we certainly recognize that not everything has to be fresh, and we certainly recognize that it can be a whole lot more cost efficient if people, make other options as well.
But don't you think that most of the Canadians prefer like frozen and processed food?
Well, with respect to the food guide, we really discourage people from, we want to limit their amount of processed foods that they eat. But if we look at the Canada Food Guide, we can see that a lot of it is really fresh fruits and vegetables, or frozen, or again in canned, and that is absolutely still very nutritional. And with respect to the meats and proteins or the plant-based that they choose, we can certainly see that there's a good round of options that are available.
What do you think what people should take away from this new food guide?
Well, first and foremost, I guess we certainly want to make make sure that we can make Canadians make the healthy choice. But to make the healthy choice, we also want to make sure that it's easy for them. And when we look at this food guide that we've launched in January and again today in 26 languages, it's easy to understand, and I think all Canadians can really find, the items that they want, but in a way that is very easy to understand for their nutritional needs.
We will continue this chat and discuss some more major concerns in Canada, but right after a short break. Welcome back after the break. We have in conversation with us the Health Minister of Canada, Honorable Ginette Petitpas Taylor. Minister Taylor, so other major concerns of Canada I want to discuss is mainly is opioid crisis. If we see the figures, the numbers between 2016 and 2018, there were around 9,000 opioid deaths. So what is government doing to deal with this?
Well, first of all, we just received the last quarter figures that came out, and for the past 3 years, we've actually lost 11,577 Canadians as a result of the opioid crisis. So we are certainly in the midst of a national public health crisis when it comes to the opioid epidemic, and our government has and will continue to take action. The first thing that we've done when we formed government back in 2015, we restored harm reduction as a key pillar of our drug strategy. So we certainly recognize that we had to make some regulatory changes to move forward, and our government has been busy in doing so. When we formed government back in 2015, we have to keep in mind that there was only one supervised consumption site that was operational in Canada. And in actual fact, the government of the day was bringing them to court because they wanted it to close down. Since we formed government, we have over 40 supervised consumption sites that are now operational across the country. Supervised consumption sites, we have to be frank, save lives. Out of all of the visits that we've had to the supervised consumption sites over the past 3 years, we haven't seen one loss of life. So supervised consumption sites certainly have a role to play when it comes to addressing the opioid crisis. The other thing as well that our government has done, we've made some regulatory changes to make sure that medication replacement therapy is more readily available. We have to keep in mind that as Canadians, no one wakes up in the morning and says, I think today I'm going to become addicted to drugs. So we really have to have a compassionate approach, and we have to treat this matter as a medical issue, because that's really truly what it is. And that's why that our government has moved forward in making regulatory changes to make sure that medication replacement therapy can be more readily available. The other thing as well that we have done, we have made significant investments on the ground as well, because provinces and territories and frontline service providers have told us that they needed more resources. So as a result, we've made significant financial investments to make sure that we could provide the frontline services with additional services and supports. And finally, we certainly have made naloxone, the antidote, more readily available without prescription medication. And really across the country right now in Canada, most people will have access to naloxone free of charge in many jurisdictions. So we recognize there's no one solution to address the opioid crisis. We really have to have all hands on deck. And as your health minister, it's really my number one priority. It is the file that keeps me up at night. And when I talk about the 11,577 lives that we've lost, these aren't just numbers. These are our brothers, our sisters, our neighbors, and our loved ones. And as a result, we really have to have a compassionate approach to effectively deal with the situation on the ground.
Talking about the cannabis, we know that it's legal in Canada now, but pot edibles, they are a big threat because they're very appealing to the kids. Recently, the labeling requirements were released, but do you think those requirements are enough?
Well, we certainly want to make sure that everything that we do when it comes to cannabis legalization, we really want to focus first and foremost on our children. The reason why that we moved forward with legalizing cannabis was that we wanted to protect our children, and also we wanted to displace the black market. We recognize that it was easier for children to purchase cannabis than it was for them to purchase alcohol. So the old system wasn't working, and that's why that we've moved forward with legalization. Now, with legalization doesn't mean that we're telling Canadians or children that it's safe and effective to use cannabis. To the contrary, and that is why that we've made significant investments in the area of public education and awareness, because we want to make sure that youth and Canadians are aware of the risks associated to cannabis use. When it comes to marketing to kids as well, we've certainly put some strict rules in place, because we want to make sure that any product that is out there is not going to be tempting or appealing to children. We've been strict with respect to the rules that we've put in place. Some industry group thinks that we've been perhaps a bit too severe, but at the end of the day, as your health minister, it is my #1 priority is to protect our youth, and we will continue to make sure that we do all that we can to keep it out of the hands of young Canadians.
Also, Canadians are paying some of the highest drug prices in the world. Why is that? And is the government planning to launch a national pharmacare plan just to ensure the drug coverage?
Well, very, very good question. I think that if you've been following the work that we've been doing over the past number of years, and also in the past month, we've certainly made a significant announcement. When it comes to putting in place a national pharmacare program, we've been working towards that goal for the past few years. The first thing that we have to do if we want to be able to afford a national pharmacare program is to lower the cost of drugs. And we have been doing that work for the past 2 years. We've joined provinces and territories in order to bulk purchase medication with them, and as a result we've already saved billions of dollars over the past few years. And last month, or actually this month I should say, I've also received the final report from the Advisory Council that was led by Dr. Eric Hoskins and several community members from across the country. And one of their recommendations was #1, to make sure that if we want to move forward with a national pharmacare program, we should be creating a Canadian drug agency. The agency will be in place in order to put together the formulary. And when I say formulary, I mean what drugs should be covered by pharmacare. So that'll be the work of the drug agency. The drug agency as well's role is going to be to negotiate the cost of drugs. So I oftentimes explain to people, in this country we have over 100,000 private drug plans that exist. And through provinces and territories we have over 100 provincial drug plans. So you can see the negotiation power for all of these different groups is very limited. But if we have a national pharmacare program and the drug agency is created, they will have a bigger negotiation power. So as a result, that's why that I was pleased in Budget 2019 that the funding was made available for that drug agency. We've made it very clear, myself and the Prime Minister, that we are committed to ensuring that all Canadians have access to a national pharmacare program, because no Canadian should have to choose between putting food on their table and paying for prescription medication.
Thank you so much for sharing that information. And I think another issue I want to talk to you about is diabetes. It's a big issue in Canada. A lot of Canadians are living with diagnosed diabetes, and now the government has announced in November as a Diabetes Awareness Month after a motion was presented by the Member Parliament from Brampton South, Sonia Sadhu.
Well, I have to say, Sonia Sadhu has been an extremely, really great advocate when it comes to diabetes, and I've been very pleased to be able to work with her as she moved forward with this motion. And I have to say, Sonia has done a lot of work with respect to our caucus to move the agenda forward when it comes to diabetes awareness and also more money in research. And with respect to that, we certainly recognize when we look at chronic diseases that diabetes is one of those diseases that is well up on the list. So as a government, we are committed to making sure that more research is provided in this area, because we certainly want to move the needle when it comes to the area of diabetes.
Absolutely, and we have seen her working on diabetes since the day she became a Member Parliament.
She has been a strong advocate, and as I said, it's been a pleasure to meet with Sonia and to work with Sonia. She's a great voice and a strong voice for the people of Brampton, and you're very fortunate to have her as your Member of Parliament.
Absolutely. Minister Taylor, 2019 is a big and crucial year. Federal elections are coming up. What issues you will be focusing on during your election campaign?
Well, there's certainly a number of issues that will certainly continue to be a priority. I know for myself, as being a Member of Parliament for Moncton, New Brunswick, actually Moncton, Riverview and Dieppe, I better get the riding name right, and also as the Minister of Health, we have to continue governing this country, #1. So with respect to my priorities as the Health Minister, I'll continue to move forward on the implementation or working towards a national pharmacare program and the many other initiatives that we're working towards. At this point in time, we're finalizing our platform, and we're looking forward to be able to sharing with Canadians the continuation of the work that we've been doing over the past 4 years. I have to say, as the federal government, our priority has really been to invest in Canadians, and as a result, we have seen the difference that our investments have made. We have lifted over 300,000 children out of poverty in this country. We've lifted over 850,000 Canadians out of poverty. We've seen the unemployment rate is at a record low right now, and Canadians have created more than 1 million jobs in this country. So our plan in investing in Canadians is working, and I'm committed, and our government is committed to making sure that we continue on the path forward, because when you invest in Canadians, you certainly can't get it wrong.
Any message for our viewers?
Well, once again, we certainly are looking forward to continuing the good work that we're doing. It's been an honor and a privilege, and really a tremendous opportunity to serve as your health minister, and I'm looking forward to continuing this important work for Canadians.
Thank you so much for joining us. It was a pleasure talking to you, and we wish you good luck.
Thank you so much.
Thank you.